Hey, today on the Dream Baby broadcast, we are going to talk about 10 tips to help protect your child from the flu. So don't go away. Now, a lot of you have been asking me questions about this. I know that you are all worried. I'm worried too. There's so much flu going around in the area, and there's so many of you with little tiny babies. So let's talk about how we might do some things to protect your child and yourself and your family from the flu. Number one, it's not too late to get a flu shot if you haven't done that already. Now, you have to, your baby has to be over 6 months old to get a flu shot, but you can get one if you have not already. Now, you know that it takes a couple of weeks for that flu shot to take effect. So in that period of time, you still could get the flu. So don't call me and say that flu shot gave me the flu, because you know that's not true. You still could be exposed to somebody with the flu in that period of time, and even if you do get a flu shot, you still could get the flu. Secondly, we know that there's a mutation of the flu virus, and that's why there's so much flu in the area, because the flu shot is not as effective as we would like it to be. So does that mean you shouldn't get it? No, because even if you get the flu shot and you still get the flu, your chances of having as difficult a case of the flu is lowered. So what does that mean? So say you get the flu shot and you still get the flu, your case of the flu will probably be a lower case or a less difficult case, and you'll have a shorter duration of the virus. And then one of the biggest reasons why we get the flu vaccine is because we want to lessen our chances of complications. And we know that babies and older people have a much higher risk of getting complications and getting hospitalized from the flu. And so the flu vaccine protects you from those complications. And so that's the biggest reason why we get the flu vaccine. So if you haven't had the flu vaccine, go ahead and get it, number one. Number two, hand washing. Can't say this over and over and over again. So these 10 tips that I'm giving you not only protect you or help prevent the flu, but they help prevent you from getting all kinds of illnesses. So these are not just, for the flu, they're for everything. Wash your hands and teach your children how to wash your hands. So this is a great opportunity to talk to your toddlers and your older children about the importance of hand washing. So we're not just talking about sticking their hands under the water. We're talking about teaching them how to use soap and water, wash their hands, washing the back of their hands, washing all their hands, and really getting that soap around there. One thing that you can teach them is singing the happy birthday song, just like with brushing their teeth. We talked about that. So washing their hands and singing the happy birthday song, so they really are getting some good friction and they're washing their hands for the appropriate amount of time. So teaching your children to wash their hands is really, really important. Number three, we just said number two. Number three, kind of goes along with washing your hands, is not touching surfaces. So when you're going out in public, there's an opportunity to touch things, and your children touch things, and you see that they just touch everything. They touch things, and then they put their hands in their mouth, and they touch things, and they touch their face, and they touch their eyes. So trying to teach your children not to touch things, it's really hard to do, I know, but even yourself, not touching things yourself. So when you're going out in public, kind of using that trick of opening the doors with your elbows or turning around and opening the doors with your body, trying not to touch things. Another trick that a friend of mine taught me, who's like super germ phobic, is most people are right-handed, and so they're going to open a door with their right hand. So even trying to use the left-hand door instead of the right-hand door, because fewer people open the left-handed doors. Just little tricks like that. Bringing your hand sanitizer, and even bringing like your Lysol wipes and wiping down surfaces before you touch things. So if you sit down in a food court, for example, wiping off your table because you have no idea who sat there. You don't know if they wiped it off first. So wiping down surfaces really well. Being particular about what you touch in public places. And going along with that, cleaning high touch areas. So when you put your child in the grocery cart or in the cart at Target, wiping down those surfaces that your child might touch before they touch it. Using hand sanitizer in public places, wiping your hands of your child really well so that they're not touching those public surfaces. Those are all kind of go along with keeping your hands clean. Children touch their faces all day long. They put their hands in their mouth, and you don't know who's touched a surface. The flu viruses and cold viruses can live on a surface for a really long time, 8 to 24 hours. And so if those viruses got airborne and then landed on a surface, if it hasn't been wiped off with a sanitizing agent, it's going to live there. Your child can touch it, touch their mouth, touch their eyes, and then they've been exposed. So hand washing and then washing down surfaces is really important. The same with wiping down your high touch surfaces in your home. So I know that you're keeping a really clean house, but you want to just double your efforts there. So cleaning down your surfaces in your homes with a CDC approved cleaning surface agent. So that would be, your Clorox, your Lysol, things like that. Now I know that a lot of you don't like the thought of that, but those are the cleaning solutions that are going to kill germs. And so it has to be something that's going to kill germs. It's not going to be vinegar. It's not going to be your essential oil sprays and things like that. You can use those if you want to as an adjunct or an additional cleaning agent. And so you need to have something that's CDC approved. So it's got to be an agent that's got bleach in it if you want it to kill your germs. And the solution to that is 1/4 to 1/2 cup of bleach solution to a gallon. And wipe those surfaces down. You want to clean your toys more frequently. You want to clean your high traffic, high touch things like your phones and your cell phones and your light switches and your doorknobs and things that people are touching all day long. So think about cleaning all those surfaces. And sometimes you just don't think about that, that people are coming in and out. You're coming in from the outside, you're touching your doorknobs. You're coming in from the outside, you're touching your light switches. You're coming in from the outside, you're touching places before you have a chance to come in and wash your hands. And those surfaces have germs on them. Next, you want to avoid crowds as much as possible. And we've talked about this a lot, maybe not going to church. Because people will come, places where people will come even if they're sick. So indoor crowded places are places that you want to avoid. And if you can't avoid coming to an indoor place, you want to keep yourself separated from other people. And so if you come into an indoor place and there's a place where you're going to sit, if you could not sit directly next to somebody. So if it's a waiting room that you need to go to, put a couple of seats between you and the next person. You may ask your child's teacher if they usually sit in groupings where they have like 4 desks together. You might ask your teacher during this season if she can separate everybody so everybody's seats are separate, maybe in rows or maybe individually, so that the child's seats aren't grouped together, because you don't want children touching each other this time of year. So avoiding public places if you can. This may be a time where you might not want to go to any extracurricular activities. So maybe your child is in a dance class, or maybe they're in Jamboree, or maybe they're on a sports team. And maybe for the next couple of weeks or month or so, you may want to choose not to go to those activities where there are a lot of children congregated together. The other places that you might want to not go would be maybe you're just absolutely stir crazy and feel like, I just need to get to the gym, and your gym has a child care facility. Putting your child in that child care facility may not be the appropriate thing to do right now. And let me give you an example of why you might not want to do that. you guys are really, really great about taking responsibility for your kids. And I know several of you have said, I've kept my child out of preschool for these couple weeks just because you're concerned about, what your children may get. Other parents may not be that conscientious. And so there may be other moms whose kids have been sick, but they're just going crazy and they're just like, I just got to get out of the house. They're feeling better today, and I think we'll just go out today. And they may take their kids out, but their kids have had the flu. They may say, they're feeling better, and then they get back home, and then the next child starts running a fever, and their next child actually comes down with the flu that day, and they've exposed your child. And that happens frequently. I actually got a phone call from a relative asking me about symptoms of the flu, and then on Facebook I saw where they had gone to a children's event and had taken all their children with the flu to a children's event. So it happens. So you don't know who is sick and who's going to expose your children. So until the season's over, you really want to limit the places where you go. The next thing, and I'm not even sure what number I'm on anymore, I think it's 5, is you want to keep your children really hydrated, because the mucus in your body helps to bring all of those germs back up. There are little hairs, mucus hairs in your membranes that will bring the germs back up out of your body. And if those little mucus hairs aren't working, then all those germs will get down your respiratory tract and into your lungs and will make you sick. And if your child is dehydrated or not hydrated well, that mucus pathway doesn't work very well. So keeping your child really well hydrated will actually help them to not get sick. So keeping them really well hydrated really helps. I don't even know what number. I'm not even gonna number them anymore. Boosting your immune system. So we know that there are some things that boost your immune system. Staying very healthy. There are some things that work really well. Good nutrition is a part of that. Now we know that there is no food that prevents or cures illness, but good nutrition overall helps you not to get sick. So a well-balanced diet with whole foods like fruits and vegetables, your basic, all your food groups that are healthy for you helps you to stay healthy. But there's no one food or one food group that prevents or cures illness. Now, if your child is not healthy or is missing some food groups, then it's okay to supplement that with a vitamin. But it's really better to get your vitamins from whole foods. So it's better to eat an orange than to drink orange juice. And it's better to drink orange juice than to take vitamin C. Does that make sense? But the best choice is to eat the whole orange, because you're getting all of what you need from the whole orange, than to eat the orange, drink the orange juice, than to take the vitamin C. Okay? So your body needs everything, and there's no benefit from taking a mega dose of something. So your recommended daily allowance of your vitamins and minerals is what you need. You don't need any excess of that, because what your body doesn't need, you're just wasting it. You're just going to excrete it from your body. And even excess of those can store up in your body and can cause illness. So it's better just to get what you need from your foods. Okay. The next thing that you need that boosts your immunity is a lot of sleep. So good rest is very important. Toddlers need about 12 hours of sleep a day. School-age kids need about 10 hours of sleep. Babies need more than that. So make sure that your kids are getting a lot of sleep. Sometimes if you're really on the go and you've got your kids in too much activity, they're not getting enough sleep and they'll get sick. You know, as an adult, if you're not getting enough sleep, you get sick. So making sure your kids are eating right, getting enough exercise, and getting enough sleep will help them to stay healthy. Another really important one is to avoid cigarette smoke. We know that kids that are exposed to secondhand smoke have a lot more colds, and their colds last longer. And so that can just play right on over into asthma, flu, all of these other illnesses. If your kids are exposed to secondhand smoke, you are just setting them up to get sick. So it's a really good time to quit. And a lot of parents will tell me, well, we don't smoke in the house, but that does not matter. Secondhand smoke comes in on your clothes, it comes in your hair, it's in your car, it's all over the place, and your kids are exposed to that whether you're blowing smoke in their face or not. So it's time to quit. All right, and I think this is number 10. We love to kiss our kids. We love to kiss our kids, but you might want to do some air hugs and air kissing, particularly kids kissing other kids. And until the flu season's over. And eating after each other and drinking after each other is just, we got to stop that until the flu season's over. So trying to get your kids to not be right in each other's face, particularly if you have a baby. That's really important. And I think I did leave one out. Use paper products. This might have gone along with touching your surfaces. Maybe use paper products during this time of the season, because if you can use paper products like paper plates and and cups, you can just throw those away, and you're not getting like a lot of germs on your utensils and your plates, and you're not having to wash all of that. And there's been some documentation that actually helps, particularly if your kids are already sick. But even during this season where you're trying to avoid some things, I know that's not environmentally friendly. But if you can use some paper products during this time, that might help to cut down on some germs. But particularly if your kids are already sick, using some paper products and throwing those away might help. Now, I do want to touch on essential oils, because I did get some questions about that. Can we boost our immunity with some essential oils? Particularly, there were some questions about elderberry syrup and some other things. Now, I'm going to tell you right off the bat, I'm not an expert on homeopathic medicines. I'm not an expert on essential oils. I'm not an expert on any of that. But I'm going to tell you what I do know. There have been some studies particularly on elderberry syrup, and it actually looked at a combination of elderberry syrup and echinacea together. And there were a couple of studies that looked at that and actually compared that in adults with Tamiflu. And they studied that for the flu. And in that particular study, it did show that elderberry syrup was as equally effective as Tamiflu in the treatment of the flu in adults. Now, that was one study. I think there might have been 2 studies actually. And that was in adults. So what can we say about that in children? Nothing. You can't take an adult study and extrapolate that information to children. Children and adults are vastly different in how they compare to adults' medicines. And so we can't make any kind of take any kind of information from that and say, because that worked in adults, will it work in children? You can't even make a blanket statement about that because it was such a small study and it was only done one time. However, that may be good, it may not be good. This is what I say about essential oils and supplements. Number 1, if you believe strongly in essential oils or you have a desire to use essential oils, that study, first of all, wasn't a preventative study. It was a treatment study. So there's nothing that says that elderberry syrup would protect you from the flu. It said that, first of all, that they got better faster, and it was a couple of days faster. Okay, so it didn't protect them from the flu. But first of all, if you have any kind of questions about using essential oils, number 1, discuss that with your child's doctor, first and foremost, always. Number 2, know which essential oils are safe to use in children, because all essential oils are not safe to use in children. Some essential oils are very dangerous. There are some essential oils that actually cause significant side effects in children, like seizures, allergic reactions, skin rashes. So some essential oils are just as dangerous as some medicines are. So know which essential oils are dangerous and which ones are safe. There's a long list of ones that are dangerous and a shorter list of ones that are safe. Know which ones are safe. Know the right dosages. So essential oils are very, very concentrated, and 1 drop of an essential oil is equivalent to like 40 cups of a medicinal tea. So if you got the concentrated essential oil and you were going to make a tea out of that, 1 drop is the equivalent of 40 cups of a medicinal tea. You wouldn't serve your child 40 cups of a tea, so you have to know what the dosage is. So you have to be really, really careful about what you're giving your child. So you have to know the appropriate dosage. Next, never give your child an essential oil by mouth. You have to know which kind of essential oil you're using, and you can't give them the oil by mouth. That's really, really important. Next, if you're going to give them something that's topical, the oil that's topical, it has to be mixed with a carrier oil. And that's really, really important because they could get a really bad reaction from that. And children's skin is really, really, really thin. And so if you put that essential oil, even with the carrier oil on their skin, they could get such a high absorption from that, they can have some really bad reactions. So you always want to put that on a really thick part of their body, which is oftentimes why they tell you to put it on their feet, because the skin on their feet is very thick. But the skin on our feet is really, really thick because we have calluses and all of that. But the skin on babies' feet is still very, very thin. So you have to be extremely careful. Next, never use a vaporized form of an essential oil in your home if anybody has any kind of respiratory problems. So if you have anybody who has asthma, if you have anybody who's got bronchiolitis, or if you've got somebody with the flu and they're having a lot of respiratory problems, you don't want to use that vaporized form because you can cause some pretty serious respiratory problems. You also never want to use any of the essential oils anywhere near their airway. So you wouldn't want to put it on their chest or on their face or anywhere where they could breathe that in. You also don't ever want to use any of the essential oils for teething, because some of those essential oils, like you can mix those up as a teething solution, but some of those essential oils cause numbing of the respiratory tract, and then they could not even swallow their saliva and they could choke. Okay, so after all of that, those are some pretty significant cautions. There are different formulations, and you have to know which kind of formulation you're using with your child in order for it to be safe. I am not going to recommend anything for or against because I am not an expert, but there are a lot of experts. You have to know who you're dealing with. Is it an essential oil expert, or is it just a rep who's selling them? And is that representative really well versed in all of the uses, or are they just a representative for the company who's selling them and they've had a short training? So you really need to know who you're dealing with. And always talk to your pediatrician and make sure that your pediatrician knows that your child is using these products because they can interfere with other medications. Okay, so that was way an aside, but I wanted to make sure that you knew that because I don't want your children to get sicker than what they could. There are no documented studies that say that any of these medications are safe in children. And that's why the CDC and the FDA has gotten kind of concerned about essential oils, because medications go through clinical trials and to determine if they're, first of all, if they have any side effects, and then they go up to, do they show any effect in disease, and then next, what's the appropriate dosage. But when you use essential oils, they've been marketed as like nutritional supplements and different things like that, and they're not marketed as medications, and so they haven't gone through that clinical trial process to be able to prove that they actually are effective in treating disease or preventing disease. So that's that. Now, if your child gets the flu, what should you do to protect your family or other people? First of all, you need to keep them separated. Now, your family may have already been exposed because you're part of the family, but try to keep them a little quarantined. So maybe keep the one family member separate from the other. Again, use your paper products, your separate utensils. Keep those families, eating utensils separate from everybody else. Teach your children to cover their mouth and their nose when they cough and when they sneeze. And there's a really cute little Sesame Street video that teaches that. But you want to teach them to cough and sneeze into their elbow. Achoo, achoo. If they use tissues, have them use their own tissues. Sneeze and cough and blow their nose into their tissue. Have their own little separate wastebasket, and then wash their hands. Every time they cough or sneeze or blow their nose, throw their tissue away, wash their hands. Having tissues all around is, just one way that you're spreading germs. So dropping them in their own little trash can and washing their hands. Let's see what else. Keep them home until they're well. And that's really one of the biggest things, is keeping them home until they're well. Well means 24 hours without fever, non-medicated. And I think that's one of the things that's happening is kids are going back to school, they're going back to daycare while they are not well, because they will get some Tylenol or ibuprofen, Advil in their system and get sent back to school because they don't have a fever, but they don't have a fever because their fever's being artificially kept down. So they have to be completely well before they go back. And that is that. So I welcome any questions, any comments. I hope that helps. There's no magic pill, and I'm sorry to say. We're just going to try to do the best we can to keeping everybody, healthy and well. But these tips are going to help to keep your kids safe and protected, and just be on the lookout for the symptoms that you have. Now, do you need to run your kids into the doctor when they're sick? You can call your doctor's office. The last thing you want to do is go to the ER, because you're going to sit in the waiting room with a whole bunch of people who are sick. So you're better off calling your pediatrician. They may or may not want you to come in. You don't have to have a flu test to diagnose the flu. They can diagnose it by your symptoms, but it's up to your pediatrician what they want you to do. So I hope that's helpful for you. Give me some comments and let me know if you have any other questions, and good luck.